All right. So today I'm super happy to be here with Dr. Yoshi Rahm, and today we're going to be talking about all things ozone and EBOO. I have the pleasure of having him on. He's got a wealth of experience and has worked as a practitioner on the West Coast for many years, and is probably one of the earliest people in the United States to start with EBOO that I'm aware of. So Dr. Yoshi, I'd love to give you an opportunity to kind of introduce yourself, give us a little bit of your background and what got you kind of into the functional medicine integrative space, what led you towards ozone therapy and EBOO specifically back when you got started.
Yeah. So long story. So cut me short, please. Feel
Sure.
feel free to jump in and redirect me. Um, I raised in Northern California, hippie parents, always kind of interested and influenced in the integrative health space. I am a doc went to medical school residency, started my own practice right out of residency in 2011, and very quickly went to all the integrative conferences and kind of went into the integrative and holistic space. My father was diagnosed with ALS right when I graduated, and was starting my own practice. And most people at this point know that ALS is kind of a deteriorating condition until you die. There's not a lot that mainstream medicine can do, and not a lot that integrative or holistic medicine can do at the end of the day. And so, but what that did was it very quickly opened my mind to, okay, how do I get as much information as rapidly as possible and implement it as rapidly as possible? Because I loved my dad dearly and wanted to do everything I could in my power for him. And so that again, that just kind of laid the foundation of how I think and practice medicine, or have practiced medicine since I've been a physician. And he was given 12 to 18 months when he was diagnosed, based on just really how rapidly he had progressed. That was per the neurologist, and we ended
Yeah.
up
So
getting
you had a
him.
lot of urgency around all of that then.
Yeah,
Yep.
exactly. And I mean, there literally nothing they could do. They had nothing to offer, right? And other than more testing, right, and monitoring. But we what I was able to do for him was get him almost 5 years more of life. And and my dad had he's an amazing person. And so it was a good quality 5 years, even though he was deteriorating oftentimes. He had the mind, he wanted to be alive and wanted to still, actively use his mind. He enjoyed engaging people tremendously. And so it was very rewarding to do that. And, there's a few things that I think I could attribute why he got ALS. They're kind of outside of the mainstream, but also just, I don't, for out of maybe somebody cares, but I think IV phosphatidylcholine was one of the major things that kept
Mm.
him kind of plateaued. So all of that to say, that's how I approach a lot of these things, and a lot of new technologies that are coming down the pipeline, that have come down the pipeline over the years. And fast forward, um, geez, when did my mother-in-law, who I also adore, was diagnosed with idiopathic pulmonary fibrosis. I think it was 2017. I'm getting so far out now that I might be off by a year. But for those of you who don't know, that's not quite as well known and understood as ALS, but it's a slow, really fibrosing or scarring of the lungs until you die. Typical course to death is maybe somewhere around 3 to 5 years for most people, or get a lung transplant. She actually had her mother died of it, a brother died of it within a couple of years, and a sister who was diagnosed after my mother-in-law actually died a few years ago from the same thing. So interesting, because there's a large genetic predisposition, perhaps. maybe environmental. They're all from the same family, right? So who knows? But that's when I got into, again, it's like her mainstream physician had nothing really to offer her other
Mhm.
than to go on one of two medications that slows the progress of it, but doesn't treat it, doesn't cure it, right? And so that's when I got into the stem cell realm,
Sure.
did some IV stem cells. It
Yep.
brought her oxygen saturation right back up into the normal range. And she's basically been steady ever since. And now
Wow.
we're
So
going on
she's still with us then.
7 or 8 years.
Oh, that's amazing.
Yeah, and it's just I mentioned her family history of having three family members pass away from the same thing because it really
Yeah.
none of them had access or were interested and or had access to the alternative medicine space. And so it's just this really interesting kind of dichotomy of what can be offered in the integrative space. And the, fast forward a few more years from that to 2020, I think we all know what happened in 2020. Um, I was exposed to this idea of ozone dialysis. I saw kind of a crude version of it being done actually before the pandemic. And then, like a month or two later, um, the pandemic hit. And that was right before, very early days, didn't really have a great understanding. But I'm thinking, okay, I want another tool in the toolbox for my mother in law specifically, right?
Absolutely.
I've seen this contraption. I liked the principles around it because of and we can get into what ozone is and does in the body later, which is for the sake of this kind of initial story. It's like, I love the idea of it. It made a lot of sense to slowly introduce ozone and oxygen into the bloodstream, perhaps.
Hmm.
And so, but I actually didn't know at the time about a Malaysian EBOO device. I did not know that there was a product out there already. And so I just kind of put on my little scientific gizmo hat and started building this because nobody I knew, nobody in my circle could direct me or give me this machine. And so I spent about 6 months and it was fun. I mean, it was the first time I'd really kind of invented something, even though it had already been invented elsewhere. I was not aware, so I was kind of like recreating the wheel, even though the wheel had already been designed at least outside of the country.
Right.
Um, and so, yeah, that kind of takes us up. And so been doing EBOO, started doing EBOO on our very first patient outside of myself. And then I think my mom was patient number two. And
Okay.
then very first patient was like October, I think it was October of 2020.
Okay. So you've got about 5 years under your belt.
Yeah.
Years go by
Yeah.
quickly.
Yeah. Crazy.
So you have a pretty fun story as far as your development of your EBOO in trying to figure out pressure and all that kind of stuff. So why don't
Yeah,
you
I
share
mean,
that real quick? Because I
Ebu's
love that story.
like Ebu's a lot of tubes, only one coming out of the body, one going back into the body. So most of the time, I mean, they can be done in veins elsewhere on the body potentially, but most of the time the blood's coming out of one arm vein and then back into a vein in the other arm. But I tell you, when something looks simple, I realize how hard it is. There's a lot of different pressures to consider and diameters of tubing and malleability of tubing and how fast to pump and how fast not to pump and how fast to introduce the oxygen and ozone gas mixture and how fast to how fast to vacuum that pressure out. Different filters create variations in all of those things. Yeah. So there's a lot to consider, and when the products aren't already out there, I was kind of, putting together my own kits made out of many different parts from different manufacturers, and of course, trying to do it in a really safe way, right? That's like priority number one when it comes to patients, safety. Originally on myself, it wasn't so much about safety, and so there was definitely those pressure gradients caused some splattering of my blood on the walls, and a little bit of faintness at times, and discovered also that it can cause some hypoglycemia or low blood
Sure.
sugar rather quickly as well. And but it was, all in the name of science on someone else's behalf. At least that's what I tell myself.
You're
But eventually we
experimenting
were
on
able to get a
yourself and
really
not on a
safe
patient,
product
right? So it
and do
makes it a
it.
little better.
Yeah.
Yeah, amazing. Well, thanks for sharing that story, and thanks for just being the type of person that'll go out there and just kind of do the research themselves, kind of really just implement that ingenuity and what can we do to actually like further science and further medicine and use the tools and the knowledge that we have, and how do we make it better, right? I think that's part of the goal as far as just what we do here in our clinic too, here at Valley Water Medicine and Fargo, is we will, take the different tools that we have and how do we combine those different tools to perhaps get a amplified result, right? Because 1 plus 1 sometimes can equal 4 or 5 if we're doing it
Yes.
right.
Yeah. Yeah.
Um,
And I think a lot of times, mainstream medicine, I think we've all heard the analogy, like if we're in a car accident and my leg's been severed, it's like take me to the emergency room and
right.
get me surgery, right? There's amazing advances. And yet it's also from the chronic disease standpoint held back because it's too they focus on too much having this perfect scientific research to guide their protocols, right? And sometimes when it comes to especially a human being who is so complex, and we
Mm,
every individual is so unique, and that's where I really view it as like it's an art and a science, and it's how you connect that with the individual person in front of you in the most logical way, right? I think a lot of people don't, even providers don't necessarily use logic. They might just like shotgun approach, like I'm an integrative, doctor, and I'm gonna shoot everything at somebody. Um, but there's a way that is the most logical way, and it might not always be the perfect way, but it can be a learning process with
absolutely.
in tandem with the patient and the patient's feedback.
Well, and I would say our patients teach us every day as much
Amen.
as we think that we know. Every time we sit down with a new client, we're learning something new.
Absolutely.
Everybody's unique. Everybody's an N of one. We never know how each person's going to respond. The things that I've done for some people that have worked for many, many other people, for some reason, one person gets no response or perhaps a negative response. So
Yep.
it's not always easy, that's for sure.
Mm-mm. But it's fun.
It is fun.
It's fun to
Because
figure
we get to
out.
see clients get better every day, right? And they
Yeah.
feel better.
Yep.
Well, let's maybe take a couple minutes because today this conversation really is focused on ozone and EBOO. What let's define ozone real quick because people may be listening to this recording, and certainly I want to share this with my clients. So how generally I describe ozone, and perhaps you can give your input on this if you have a different way of thinking about it, but ozone's O3, right? Oxygen's O2, ozone's O3. So it has that extra oxygen molecule on it. So when we put it into the body, and we can put it in the body all sorts of different places. I do prolozone injections and treat the blood, do all these kinds of things, right? But what happens is that extra oxygen molecule is unstable, so it dissociates really, really easy off that O2 molecule. So what that does is super oxygenates the tissue. So when it's in the blood, it's been shown to have benefits as far as improving oxygenation of the blood, improving blood flow,
Hmm.
Also, it has antiviral, antibacterial, antiparasitic effects that has been found, antifungal effects as well in studies. Um, and so many benefits as far as just ozone in particular can help balance blood sugars or lower blood sugars. As you mentioned, you had a hypoglycemic event during your EBOO experiences. And anything that you would add to that as far as how you would describe EBOO or some of the potential or ozone or perhaps some of the benefits associated with it?
Yeah, that I mean, you nailed it. I'll just kind of add because it's easier listening to you. It's easy for me to think, oh, what else could I add? And ozone. I think some people still, although ozone therapy in the United States, well, it's been used in Europe for many decades. It's still kind of new in the States. Kind of new, meaning maybe a decade or two. It's been used, but it's becoming more and more popular. And yet, still, some people are like, ozone. Isn't that bad? Isn't that smog or
Very
the
toxic. Yeah,
the ozone layer, right? And so um, it is really important to note that they measure ozone they measure levels of smog by detecting ozone. But ozone is like the innocent bystander. It's kind of like driving by a house that's on fire and seeing the firefighters there and saying, oh, the firefighters caused the fire. Well, no, they're there to fight the fire, right? Like ozone is there to actually fight the effects of smog.
mm,
So I like just kind of pulling that out, and then yes, how it can also be very therapeutic in the blood. And usually when we're using it in prolozone or EBOO or some other kind of IV MAH, major autohemotherapy, um, us only a couple there's only like 1 to 3% of the gas is ozone. The rest is actually oxygen.
right.
And it's just that little bit of ozone, because, like you said, it is so reactive in the blood, reactive in a good way, as long as it's being dosed appropriately, right?
Yep.
That's the other thing I love to kind of highlight. Oh, isn't ozone bad for you? I pretty much always say like everything can be a poison in the wrong dose.
For sure.
Everything can be a toxin in the wrong dose. Most things can be medicinal in the correct dose for the correct person at the correct time, right? And I'll usually say like we can't breathe 100% oxygen, otherwise that'll kill our lungs, right? The
Mm-hmm.
atmosphere is only 21% oxygen. If you drink 10 gallons of water, you'll probably have a seizure and convulse and perhaps die. 10 gallons really, in like very short amount of time. Is water
Right.
toxic? Well, it depends, right? It depends is always the
Depends on
answer.
the dose.
Yeah, depends on the dose. Um, and so, kind of on that vein, or on that thread, there's kind of, if you give too much ozone, too high of a dose, or give it too rapidly, it can turn on a certain pathway, NF kappa beta, I think it is, and that creates too much of an inflammatory burst in the system, in the body's system. And so sometimes people might also hear about the negative effects of having had an ozone therapy session of some sort. And I think it's because people are using too high of a dose.
Mm-hmm.
10 pass is pretty common. It's a great therapy, but it tends to use a really high concentration of ozone. And so it's
Right.
just really important to use it correctly.
Yep.
Versus when you're using it in lower doses, it turns on the NRF2 pathway,
Yep.
which, not to get too technical, but it actually, with the NRF2 pathway, and you feel free to chime in here, fill in blanks that I leave out, but it really causes the body's antioxidant system to turn on. So it's like it causes our body to create our own antioxidants, which can be profoundly healing at times, profoundly magnificent at fighting inflammation in our body, or if our immune system is running amok or in overdrive, it can kind of tamper that down. So I like to draw the distinction between safe doses, versus, safe healing doses versus potentially toxic doses.
Yeah, absolutely. And I think that to be clear on ozone itself is ozone is an oxidative therapy, right? So ozone is a stress. And so how I describe it, I guess, is if somebody is lifting weights per se, right? You're straining your muscle and you're breaking down your muscle so that it responds and gets stronger. I think about ozone kind of the same way as far as what it's doing to the immune system and our antioxidant processes within our body is it actually stresses that system a little bit, which then forces it to respond and get stronger.
Yeah, that's perfect. And
Yeah.
I'll kind of sometimes also say it's like revving a car that's, been idle for too long or you haven't been used. It's like rev it up, press the gas pedal a few times, get it going, get it humming, get it ready to roll.
Yeah, and sometimes it can take the body a little bit of time to get warmed up
Mhm.
to be able to handle that oxidative stress. And so, yeah, I agree that a lot of times people will start at too high of a dose. In fact, recently I had recommended a client to do ozone therapy, and she found another provider closer to her, and she didn't come here, unfortunately. She went to this other provider. I don't really know who they were or where they went, but she had a pretty significant detoxification reaction from the ozone therapy that she did. And I asked her to dig in and get more information as far as what the dose was that she received for her major aortic chemotherapy. And so when we qualify or when we talk about ozone and the dose, there's a couple of different things, right? There's quantity and there's the concentration.
Mhm.
So she actually got probably the quantity of ozone that I would well, actually no, she got about 3 times the quantity that I would have given, but she also got about uh, so I would have started at about a 12 gamma with her just
Mhm.
because she's a sensitive individual. And at this other place, she had gotten about 68 gamma, right? And so like a huge dose of ozone that put her immune system into almost this reactivity instead of just giving it this gentle prodding. So that's really important. I also wanted to just clarify real quick for people that are potentially listening to this is that as we make ozone and we make it in the medical environment or use in a clinic, like what Dr. Yoshi and I do, we use 100% pure medical grade oxygen and we run it through an ozone generator that is a medical grade generator at the time that we're going to be using the ozone. Because ozone has a pretty short half-life and we don't want to make ozone out of the environment, right? Because if you use an environment in a, say like a air purifier type thing to maybe get rid of some smells in a room, you can get an ozone generator. Well, if you use one of those to make your ozone that you're going to use medically, you have all of these other gases in there, and it could be really toxic and make you super sick. So I want to make sure that we are clear on that nobody should ever use any of those environmental ozone generators for medical use.
Yeah, totally correct.
Um, so yeah, so we talked a little bit about ozone. We've kind of defined it. Um, there's a ridiculous number of studies now actually on ozone therapy, and so people can go on PubMed. They can type in all sorts of different conditions and look up ozone therapy. And I encourage people to do that because there's thousands and thousands. I think more than 13,000 studies now on ozone therapy for sure. I think that was the number from a couple of years ago. But let's kind of transition now and we'll talk about maybe some of the different kinds of therapies. So there's major aortic chemotherapy, right? And then I have, and I'm sure you're familiar with probably like a high dose form
Mhm.
of ozone therapy, which is essentially about 3 times the dose of major aortic chemotherapy. And then in addition to that, we have EBOO, right? So major aortic chemotherapy, at least how we do it in my practice, and I think it's pretty consistent across the board. What we do is we actually start an IV on somebody, draw out about 60 cc's of blood from that person as we're starting the IV with a little bit of heparin in it. Start the IV, give the person a little bit of saline, help hydrate them up. We'll put the blood up in the IV bag and treat it directly with some ozone therapy, or with we'll put the blood in there, inject the ozone directly into the blood in the IV bag, agitate it a little bit, mix it up gently, and then give it back to the person through an ultraviolet light. We want to give that back at a certain rate, so that way that the ultraviolet light has the ability to treat it the way that it should be. Um, and so the nice thing with that is we can really control the rate and the dose at which people receive the ozone, and it's a super effective therapy, and it's probably the most widely used ozone therapy across the world. And the nice thing about that therapy in particular is really it's pretty cheap in comparison to a lot of other therapies that are out there, but can be really, really powerful for people have an acute infection or even chronic illnesses. So, any other feedback on that?
Yeah, I mean, MAH is, I love it. You know, I think it could debate about all the different kind of alternative IVs out there, but if I had to choose just one, I think that would probably be it, is
Hmm.
MAH, just because it's pretty gentle as long as you're doing it well and doing it right, and it affects the body so beautifully. And yeah, I'm curious, what if you had one IV to pick, what would you choose to have if you were stuck on a desert island?
Stuck on a desert island with one IV. Oh
Yeah.
man, yeah.
Or
Boy,
would
I would
you?
have to go in between that and it's sodium ascorbate probably. I don't
Oh
know.
yeah.
That would be
Yeah.
hard, right? They both
Yeah.
have super great benefits.
Yeah.
But I mean oh man, that's tough.
It's a hard one, right?
It is.
There's no
It
wrong
is.
answer there.
Yeah.
But, my point was it is a fantastic IV,
Yeah.
especially as kind of an entry level for the ozone.
Well, and it's fantastic for people that just want to stay healthy and use it as prevention or perhaps performance optimization for somebody that wants
Mhm.
to go out and run a half a marathon or a marathon and just wants to
Yeah.
perform at their best.
Yeah. Big time.
Yeah. So next, so the my original training was through a company called SopMed, and we learned then, major out of hemotherapy, and we also have the ability to provide a therapy called our high dose ozone, where we take about 300 milliliters of blood, so about 3 times, or actually a little more than that, and then we will treat that with about a liter of ozone, and we will do that again, just kind of gradually titrating the person up, and some of that is dependent on their resilience and their goals and the concerns that they have. Um, and then so that process is pretty similar to major chemotherapy, but then there's EBOO, and EBOO is kind of a little bit of a different animal. And it's a little more it's a little bit more of a process for the client.
Mhm.
And I would say it's a little bit more of a almost a we want to prepare for that therapy in a little bit of a different way too. The major out of chemotherapy, high dose therapy. I feel like for the most part, as long as you've eaten, you're drinking, you're staying hydrated, and you show up for that therapy, you're pretty well good to go.
Mhm.
But with EBOO, we want to make sure that somebody has a really good high protein meal before they come. We want to make sure that their blood sugar is adequate, that they're as hydrated as they can be, so that way when they come in and they sit down, that they have as good of an experience as possible. So what types of guidance do you usually give your clients as far as if they're going to prepare or come in for an EBOO therapy?
Yeah, you nailed it. It's a good quality, healthy meal within 1 to 2 hours beforehand, and that's largely because of how ozone turns on it revs up the mitochondria and kind of starts using energy and creating energy, and it can cause a dip in the blood sugar. So I think what we found, and it wasn't the case with the first couple months of patients way back in 2020, we definitely caused a couple of hypoglycemic episodes, learned pretty quickly. And ever since then, that has never been an issue after that. The other thing is EBOO, it usually requires bigger gauge needles to go into the veins. And so somebody who has really poor veins might not be a great candidate. But
Yeah.
regardless of even if someone has good veins or just moderate veins, really important to stay hydrated with mineralized water. So I like to give people minerals and get them hydrated for sure. Sometimes if someone comes in and they're not well hydrated, we'll actually give them some fluids beforehand. Um, and then I don't, people are more familiar with it now, so it might not be as kind of scary, but you mentioned the process and it's like there's a lot of people are used to having one IV in an arm, but this is with two IVs and you're seeing your blood actually go outside of your body and through this
Mm-hmm.
filter and then coming back in and you can kind of sometimes see things in your blood and so some people can get really in their head about it and have these kind of vasovagal responses, which is largely anxiety induced a lot of times.
Mm-hmm.
So it's really important just to be in a good space, know you're in a good situation, like in your office, I'm sure, and you're well taken care of, you're going to be well taken care of, and you're totally safe, and there's not anything to worry about. But having said that, though, sometimes depending on the person, we would have them like calm themselves down however they do that best, right? Sometimes it can just be like doing some gentle breathing exercises or a meditation beforehand or during even.
Yeah.
Yeah.
Yeah, for sure. And I encourage our clients too, like if they drove for an hour or more to get here or even half an hour and then they get out of the car, they come sit in our waiting room and then they go sit in the EBOO chair. That's never a real good fit either, right? You get
Right.
up and move around, you get your blood moving a little bit, warm your body up. That's always a better fit for helping to make sure that your veins are as accessible as possible because
Yeah.
if your veins are small, they're tight, you're cold for whatever reason, it makes those IV starts a lot more difficult. So
Yeah.
keep that
Well
in mind
said.
too. Yeah.
Well said.
Um, so as far as the EBOO process itself, and I just want to describe that a little bit for people too. So like you mentioned, we're actually starting two IVs on somebody. And so most often the goal is to start in both arms. You know, we can use other locations in the body if we can find good veins. But so if somebody's not sure if there is a great candidate, they may want to have the nurses evaluate that before they come in for their actual day of their EBOO session. Because if it's not a good, if they're not a good fit, it may there's a good chance that we just won't be able to make it happen, unfortunately. Um, but what'll happen is, at least in our office, we actually have two nurses that are assigned to doing an EBOO therapy, and so they're in there because it's a fairly complicated process as far as making sure the tubing's hooked up right and that it's appropriately the tubing is flushed appropriately and we're getting good sets of vital signs, we're checking blood sugars on somebody, and then once we get the two IVs started, we leave heat packs on it that helps, that seems to help with blood flow and also
Hmm.
the comfort of the procedure too.
Yeah.
um, but once we get started, the pump will start pulling blood out of one of the veins, and as it goes through the pump, it'll go up into a dialysis filter, and the dialysis filter sits vertically. I want to be really clear about what that dialysis filter is and what it's actually doing, because I think that I've seen on social media, there's a lot of other doctors that are out there that are promoting EBOO as this amazing filtration therapy. And based off of my understanding, the the dialysis filter that's there is in a sense creating a large surface area in the blood, and so it's touching the blood in a lot of different spaces, and what happens is the ozone comes out of that dialysis filter and ozonates the blood in a really efficient manner and a really gentle manner too, because we use a lot lower gamma or dose of ozone at one time than we do in like a major auto chemotherapy or a high dose. So it's I've heard it described as, like Major out of chemotherapy or high dose is more like jumper cables to get your battery rolling. But
Mm,
the EBOO is more of like that trickle charger, right? So like it's something that's gonna be more effective for a longer period of time. It's just a lot gentler, but it takes more time to get the effect, right?
that's a great analogy.
So as the blood has that large surface area and it's continuously ozonated and oxygenated, the blood then will come up and it'll go through a drip chamber, through an ultraviolet light, and then back to the person on the other side. But like I said, the I've heard a lot of people say, "Oh, the filter is really great. It catches, you know, it'll take everything out of your blood. It'll take out heavy metals. It'll take out spike protein. It'll take out parasites. It'll take out all of these things." My understanding is that some of those things may get caught in the filter as the blood goes through. But truly, the blood is not actually going through the filter. And
Correct.
because the blood's not going through the filter isn't filtering the blood. It's not acting the same as if you actually use that filter for dialysis.
Yeah. Yeah, that's it. There's a number of providers out there who are doing EBOO who promote it as this filtration system, or another kind of common term is oil change,
Hmm.
which I think is very misleading,
I think so too.
and not truthful to what EBOO is. EBOO is amazing without being those things.
Yep.
And so yeah, you know the filter there's I do think there's some, like, it's almost like a Velcro situation where if there is a parasite in the blood and it happens to go by that filter, it could catch on the filter. But like you
Sure.
said, there's like these tiny little straws with with hundreds or thousands of little holes in them, and the oxygen ozone gas is going down, or
Right.
it could be going up, but it's going one way through the little straws, and the blood is on the outside of these hundreds of little straws, but they come in contact through those little holes. And so you're right, because you're essentially creating this ozone therapy where a huge surface area of your blood is being exposed directly to the ozone. And it's through all the biochemical processes that happen from the ozone entering into the blood that creates all the benefits that ozone can do in the body, fighting inflammation, balancing out the immune system, right? You've mentioned earlier, creating, it actually creates a situation where the oxygen in the blood actually offloads onto the cells better. It creates um, blood. It can create, if you have sticky blood, it can make like healthy, thinner blood. So, but and there might be some kind of a little bit of Velcro situation for, a lot of other toxins as well. Um, but in my mind, and I'd love to hear your thoughts on this. Most toxins are not stored in our blood, right? Only a very small percentage are actually floating around in our blood because our body wants to either get rid of them, pee them out, poop them out, or if it can't do that, it's going to tuck it away into the tissues of the body, right? So that it doesn't affect us as much as possible. And so, depending on the toxic substance, maybe only 1%, I'm just throwing 1% out there, but maybe only 1% is in the blood. And
Right.
so even if it filtered everything out of the blood, even if it did do that, you're still only taking out a very small percentage of some particular toxin. So I don't think it's fair to say that it filters out. Does it decrease a little bit of those things? Probably. There's some evidence of that from people who have cut the filters open and looked under a microscope. But it is not, its primary point of use should not be as a filtration for heavy metals, or a filtration for parasites, or a filtration system for, Lyme or mold.
Right.
It can help those conditions very much, but through the
Yep.
ozonation process.
Right.
Yeah, so
Yeah,
I
I
love
think
that. I love that you're bringing that up because
yeah,
it's all over social media.
it is. Thanks. Yeah, I think that yeah, truly, like you said, it's a benefit of the ozone therapy, not the filtration system itself,
Yeah.
right? I mean, the filter really is the ozonization conduit. So now underneath where that filter is, there's a little tube that comes out, and then we can a canister that catches this foam, right? And I think that there's a lot of misunderstanding around what the foam is too.
Hmm.
Um, and I know that based on all of the people that I talk to and that do a lot of EBOO, I think there's still a lot of questions around what exactly there is in this foam.
Hmm.
And from what I can tell, we don't really know that well, like what's actually in there. I think maybe a little bit of some plasma or byproducts associated that way, but I was wondering if you had any further feedback on that.
Yeah, no, I would just echo what you just said. I think it's mostly plasma that's, you know, been exposed to oxidation. And so there's probably most of those are proteins that have been oxidized, and plasma, which for those who don't know, there's like blood is made out of plasma and red blood cells. And so it's the blood minus the red blood cells. It's everything else that
Yep.
that makes up the blood. And so yeah, I think it's just oxidized plasma. I don't think a lot of people, again, on social media hold up and they're like, hold up their little bucket of fluid and foam or foam and like, this is what I just, this is what I just, all the crap that was filtered out of my system. Well, maybe a very small percentage, but not enough to say that and promote that as the therapy.
Yeah. Yeah. No, I agree too. And I think that there's just not a whole lot of evidence for what exactly people are claiming that to be. So I don't like I don't like saying things are what they're not. So just trying to lay out, hey, just honestly, like this is what we know, and people that are saying other things, I have my serious doubts as far as their ability to prove what it is that they're saying.
Yeah. Yeah. And one other thing that just kind of pops up, some people are still a little bit intimidated by EBOO. And yet the process is similar to dialysis, which,
Sure.
thousands of people get done every day across the United States. There's so many people with long-standing end-stage, long-standing diabetes, maybe with end-stage kidney disease or failure, and so those are the individuals who get dialysis. And it's an IV out of one arm and an IV back into the other arm with their blood going through this machine. And this is not a dialysis. EBOO is not a dialysis machine. We use a
Right.
dialysis filter, but it's not a dialysis machine. But all of that to say, like, if you have competent nurses who are well trained, it's a
Hmm.
super safe procedure.
Totally. Yep. Yep. Absolutely. So I think that describes the process pretty well. Maybe one other thing that I could mention is I mentioned that the blood will go through ultraviolet light as well, and that ultraviolet light, at least the ones that we use, have ultraviolet A, B, and C in it, which have very similar properties as what ozone does. It just works in a little bit of a different fashion. So it also seems to tamper a little bit the risk or the likelihood for people to give some of that detoxification reaction. They
Mhm.
seem to tolerate the ozone better if we combine it with that ultraviolet light.
Yeah. Yeah. Just anecdotally speaking, I would say so because um, when we were first doing EBOO, it was without the light. And the moment we introduced the light in to the sessions, everybody seemed to get just better results and easier.
Mm,
So just anecdotally speaking, I would say yes, it's better with the light.
sure. Um, so great. I think we've described the process pretty well. Generally, depending on the person, we may, if somebody's smaller or they're sicker and they need a little bit more of a gentle therapy, we may do like half of a session,
Mhm.
which is about 20-25 minutes for somebody that is maybe a little more resilient or a little bit larger person. Our full session generally runs about 50 minutes of continuous therapy through that dialysis filter. So just for people to be aware of kind of the length of what's expected with the therapy. So
Yeah, and that goes a lot. We found sometimes too, people want their money's worth,
sure.
thinking that more is better, and that's not always the case. Sometimes it's true, but those are for the very resilient people. And sometimes it's way, way better to just go slower, shorten the time, or lower the concentration. So maybe it's the same time, but just at an even gentler dose.
Right.
Yeah.
Yeah, absolutely. Well, let's talk a little bit about just maybe some experiences with EBOO as far as like, okay, it's great. That's what it is. But so what? Like, what is this actually doing? What do people actually see when they do EBOO? Um, I would say that EBOO, and I know for sure for one of my nurses in particular, it's her absolute favorite therapy. She loves getting it, and she also loves giving it. And I will say that, like, if I have a significant illness, EBOO is my go-to. Like,
Mhm.
I will do my best to call in a nurse on a Saturday and say, I need you to come in and do this for me because I'm pretty sick, right? So, like, back in January. I never tested myself, right? But I had a pretty significant viral illness, and I had been pretty sick with COVID prior to that. A lot of the same symptoms, lost my taste, and just really crazy brain fog. I utilized a lot of the services that we have here. I've got a Hawkett sauna. I did high dose vitamin C, even 100 grams of vitamin C, and I got a little bit better. But I finally got to a point where I'm like, man, this brain fog, I can't kick it. Like I'm so tired. I'm just having a hard. I'm getting over this, and so I ended up coming into the clinic, got one of my nurses to come in. She hooked me up to EBOO, and no joke, I did a full 50-minute session, but 20 minutes into my EBOO session, my brain fog was gone.
Mhm.
And I had just this amazing response and just felt so much better. And that's the second time I've used it in that sort of scenario. The previous time I had been on vacation, got a mosquito bite and got really sick afterwards when I got home, I did an EBOO and again kicked it for me. So I love using it for just kind of that acute illness type thing. I assume you've had similar experiences with some of your clients for kind of acute illness.
Yeah, for sure. And you mentioned that brain fog. I would say that's one of the that's been one of the like number one, probably I think it's probably the top like additional benefit that people have, or maybe we're not necessarily suggesting they do EBOO just for brain fog, but it's like people will get it done maybe for other reasons, and but then they're like, my mind is just so much clearer. My brain feels there's that clarity of mind that improves. So that's been kind of interesting. And then, you know, at the during COVID, we actually had it's interesting because we had two different people who came in totally sick with acute COVID, and their oxygen saturations were low 80s, like 80, 81. Um, one of them was a little bit of the reading was like high 70s. And these are people who, should have, most people would have said, you need to go to the ER right now because that low of an oxygen saturation is just not, is dangerous, which it is.
Absolutely.
Um, and in the ER, they would probably put them on oxygen, which will get the oxygen saturation up. But the moment you take away the oxygen saturation goes down unless you're actually helping to heal the body. And what was really interesting, like, okay, I'm gonna give you the ER disclaimer, but you're here for a reason too. So I remember one of them hooked him up, and his oxygen during the EBOO session just kept climbing. He walked out of the office feeling way better because his oxygenation had climbed to, I'm going to forget the exact percentages, but above 90.
Mm,
I want to say 93. That number sticks out, 92, 93. So call it the low 90s. It's like, okay, this isn't his name, but say it was Brad. Okay, Brad, like, let me know how you're doing tomorrow. Um, and the next day he had a home oxygen saturation. The next day he was up at 96%.
wow.
So my point in sharing that is like the EBOO, it wasn't just about introducing oxygen to his system during the therapy that got his oxygenation up, his O2 saturation up, but it was like it was triggering the ozone, triggered this healing response that just carried with him. And so it was like his body was healing as he's walking out the door and into the next day. And he eventually did fine with COVID. We brought him in for another, I think he got two more therapies over the ensuing, like, call it week, just to
Okay.
like help stabilize him.
Hmm.
Um, but yeah, I mean, that's the power of it. I mean, it's just so clear, right? A lot of times these improvements are subjective, like patient reports, right? But you can
Right.
see with the O2 oxygen saturation how much it helps. And then also, it was part of two studies with SOTMed originally. And it was interesting because we saw how much it can help certain inflammatory conditions, or I
Hmm.
should say markers. So it very clearly, done in sequence from one session to the next, and then ultimately even a week after the last session, very clearly it improved CRP, which is kind of a general inflammation marker. It improved fibrinogen, which is kind of a blood stickiness marker. And I'm fibrinogen, no, fibrinogen by like 25-ish%, SED rate or ESR, which is, feel free to chime in, but it's also kind of a blood stickiness and inflammation marker.
Yep.
That had
Yep.
improved in both studies. It was well over 100%. So
Wow.
just very significant and long lasting. I'm going to call a week long lasting, which can be enough to affect an acute condition or even a chronic condition, but can kind of get someone over the hump, right?
Right.
To the point where their body can then start healing better. And then one of I wasn't expecting this, but it improved the GFR, which is a measure of kidney function.
Hmm.
And one of the studies, it was like 11%. The other one, it was 8 to 9%. Which was just really interesting. So it was, and I don't even, I mean, there's a lot of ways it could maybe explain it, but I don't know is the ultimate answer. But the ultimate data showed that it very clearly helped the kidneys as well. So um, I just wanted to throw those findings out there because it's the objective data. Subjective feedback is super important. Ultimately, people just want to feel well, right? So
Right.
that's super important. And sometimes it can also be neat to get that objective data to show someone on paper, hey, and here, yeah, you feel better. Or maybe it's even you don't feel better, but your markers are actually better. So at least we can see we're making some headway. Now, is it
Right.
worth it to continue the EBOO, or is it, maybe better to pursue some other therapy? That's up to you and the patient, right? But wanted to throw those out there. I also um, saw a lot of people for mold and Lyme. Um, I think it helped a lot with, not I think, it helped a lot with mold. Lyme is oftentimes a lot, well, mold can be very tricky as well.
Yep.
But Lyme can be very tricky. And that was kind of hit or miss. But I think a lot of people were coming into our office just for the EBOO. We weren't necessarily managing their whole
Sure.
picture. And so it gets a little it's harder to do to manage that well. Um, but we had a few people rheumatoid arthritis. It helps a lot with pain.
Hmm.
as well. Rheumatoid arthritis was really well affected by EBOO. There are a lot of conditions. Yeah, I don't.
Yeah, absolutely. And I think overall just wellness, right? And performance.
Yeah.
People like I had mentioned earlier, say an athlete or somebody who wants to perform at a higher level if they're doing a race, right? It can help with oxygenation, how well their blood's flowing through their body, their recovery, um, all those good kinds of things too.
Yeah, absolutely. There's not going to name names, but definitely some NFL players who use it for a reason,
Yep.
um, because it just helps, and it's natural and um, an uh, amazing therapy. Just fun. Like I'm pretty healthy. I love to run and I love to run fast. Well, fast for me.
Yeah.
But when I've ever gotten an EBOO therapy before I go out for a really hard fast workout, it just like I feel so much lighter, so much more energetic. I can definitely run faster. So fun to experience that.
I would say another condition that I've seen benefits of EBOO in is cancer.
Yes.
I have a cancer client recently who underwent EBOO alongside of the other things that he's done, but he had a super terminal cancer and he's really been able to make great strides as far as getting turned around from where he was.
Mm,
And then yeah, what a recent woman that I can think about that we had in, she had a kind of a long-standing Rocky Mountain spotted fever
yeah.
illness that she had been struggling with. She did we did 3 EBOO over a span of I think 4 or 5 weeks. And she had messaged me back and said she finally had her brain back. Right, and
Mm,
another client that we found some chronic infections in her, but she's type 2 diabetic. And, again, this was just this last week, where she had messaged me and said, man, I feel the best that I felt in many years, and
mm,
so it's so fun to see those types of results. But I do think that I want to be clear, and I'd love to hear just a little bit of feedback from what you've seen too for people. EBOO, maybe outside of, those acute type illnesses, potentially, you may get away with just doing one EBOO at a time, just to get yourself kind of over that hump and get your body to respond and get over that acute illness. But for people that have those chronic concerns, generally what I see or what I recommend is like doing a series of 3 is probably the
mm,
minimum.
yeah.
And then depending on how sick that person is, they may need to do 5, 6, 7 EBOO, but they can start getting spread out more. So those first 3, oftentimes I'll recommend that we do them a little closer together, like once a week or
Mhm.
so for 3 weeks. And then after that, maybe once every other week, once a month, depending on their response from those kind of initial therapies. You have different thoughts on that?
No, that's pretty that's I'm right along the same vein there. I tend to yeah, get in a few closer together, about a week apart ideally, and then try in one 2 weeks later, maybe a fourth one 2 weeks later, and then just gauging, right,
Right.
with the patient, and then maybe it's 3 weeks, then 4 weeks, and depending on the situation, and what other methods are being used, um, it could be once a month for a while. It could be once every 2 months for a while. But yeah, I would absolutely concur with that general approach.
Okay.
Yeah.
Any other fun stories that you have from people that you've seen that have done EBOO?
Yeah, I mean, autoimmune conditions in general, and there's a lot of autoimmune conditions out there. Probably going from memory, so feel free to chime in. But I want to say rheumatoid arthritis is the number one most common in the
Mm,
US. Hashimoto's,
yep.
thyroiditis, lupus, right? Irritable bowel diseases, vitiligos, and so I'm just kind of naming some autoimmune conditions. But autoimmune conditions I've found do very well with it. I mentioned the rheumatoid arthritis specifically earlier. Had a few clients that definitely it just dramatically helped them. Another one is the gut. It for me, my experience with patients was it helped people with gut issues. And kind of the more severe the gut issue, the more helpful EBOO was and
Mm,
is. Yeah, including Crohn's and ulcerative colitis, actually. So those are some fun ones. A lot with long COVID symptoms,
yep.
the fatigue, the brain fog. That it can be like a really good therapy.
Yeah,
Yeah.
absolutely. Yeah, I agree. I mean, you see some really, really cool responses. And of course, like I said, I believe in it 100%, especially with the experiences that I've had myself. And to be sitting in the middle of the therapy and just have that brain fog just leave and never come back. I mean,
Yeah,
that's
that's
an
amazing.
amazing experience.
That's neat. That's
Mhm.
what it's all about right there.
Yeah. So some people might ask and say, "Hey, well, okay, you have major out of chemotherapy, you have EBOO, like why would I do EBOO instead of major out of chemotherapy?" And so, like I said earlier, I think it's more along the lines of like it's a trickle charger, something that's going to carry
Mhm.
you longer. But also I think I don't, it's not exactly apples to apples, but like if we compare like a major auto chemotherapy to an EBOO session, I guess like I feel like you almost get the equivalence of doing almost like, I don't know, 20, 30 major auto chemotherapy therapy sessions out of a session of EBOO. So I think it's just a much more efficient way of doing things. It's going to save you a lot of time. Ultimately, yeah, it can be a bigger investment up front as far as actually doing the therapy, but in comparison to doing 20 to 30 major auto chemotherapy sessions, you're way ahead financially as far as kind of how I think about
Yeah.
things.
And time wise, right? There's the
Oh yeah.
financial investment, but there's also the time investment. So it's
Yep.
like going to come in, 3 times versus whatever it is, 30 times or 50 times also. So that's another one for people to think long term about.
Right. Yeah. Awesome. Um, well, thank you so much for being here with me today. I greatly enjoyed our conversation. I appreciate your just speaking through just your experience and also your ingenuity of working to build your own EBOO back, a few years ago now, and being on the forefront of ozone therapy and EBOO and what it can do for our clients. And thank you for sharing that experience and your knowledge today. And yeah, have any kind of parting words or other feedback as far as people who are wondering if EBOO is right for them?
Yeah, I mean, well, first of all, thank you for having me on and just letting me share my experience. And EBOO is one tool in the toolbox. It's not a it's not the silver bullet for everyone. But it can be the silver bullet for some people.
Yeah,
Um, and it's not the first thing I would go to. If you have a newly diagnosed something, it's like there's probably a lot of other things to try first, with hopefully with good guidance, because it is more it's more time and financial investment, and it's it's a strong therapy. And so again, I don't want to come across as like everybody needs to go do EBOO now, right? It's like
right.
let's work with somebody who can help you decide when it's the best tool to use, because there's a whole bunch of tools in our toolboxes.
Yeah,
But otherwise, it's an amazing therapy. I'm all for it, obviously, and that comes from seeing the positive results from doing so many sessions of it over the years.
yeah, well said. Yeah, thanks for putting it that way. I think that makes a lot of sense. Um, so yeah, again, thank you for being here today. Appreciate you just being on the forefront of all of this and sharing your wisdom, and for all the clients that that you've helped through the years as well, and sharing the story of your family members too. And so if you'd like to know more about EBOO, please feel free to reach out to us here at Valley Vital Medicine. I'm Trevor Hausauer, nurse practitioner here. We've been doing EBOO here for 3 years, and we've done a lot of sessions of EBOO. As we talked about, we've seen some really good, really great, fun, amazing results. We're doing EBOO regularly all the time. It's not something that we do, once every 6 months. And so just be really careful about what office you go to. Make sure that they know what they're doing. They're doing it safely, and that they've been well trained. Yeah, let us know if you have any questions. And again, thanks, Dr. Yoshi, for being here with us today, and we really appreciate you.
Yeah, thank you for doing your work.